So I believe that I've just learned a new definition for red states and blue states, and that was a nicer way of thinking about it, actually. I was very interested in listening to these presentations in the context of some of the concerns that people have about these transformations that are occurring in cities, but particularly DC. One of the concerns that I hear a lot emanating from the community is the concern about what's called gentrification, and the kind of the conundrum. On the one hand, you want people who work in the city, who have jobs in the city, to be living in the city and not commuting in, and not certainly running away from the city. And no city can thrive if none of the people in the city generate income. That's a reality. On the other hand, some of the traditional neighborhoods being concerned, you know, as development is moving out through the city, and even with the proposals to create new amenities. So one of the things I'm aware of here is that there's kind of an abandoned bridge that people are considering developing as a park, which would just be a beautiful park, actually. And, you know, but how that very positive development might impact some of the older neighborhoods that are around that, and how the city is approaching that. So I thought maybe I'd start with that issue really for both of you.
I think later today, Hazel Edwards is coming too, and she'll have an interesting perspective on this.
Could you move the mic a little closer? Yeah, because this is something about the sound in here.
We've had 3 or 4 conversations, sort of town hall or other conversations around the city in just the last 2 or 3 weeks on this issue. And gentrification, the relationship to sustainability, but also to all the other issues that are changing the market we've got here. It's a very challenging issue, and often when we put out our goals, our challenges here, we're looking at economic growth and health and wellness and equity. The first question you get is, well, how are you going to keep the community equitable? How are you going to keep it affordable if we have bike lanes everywhere and every millennial across the country wants to move here? There's no simple answer. I mean, one of my the city's doing a whole range of things to focus on affordability in particular. With the current mayor and the mayors that were just elected, they're looking at really significant investments, $100 million a year, $200 million a year for preserving and increasing affordable housing. To be honest, even with that kind of money, it's challenging to face a market that we see here, the kind of market transformation that's happening, which really doesn't have well, it's sort of unprecedented here, the rate of growth. So just in the news in the last couple of weeks, a neighborhood in the southeast here saw a 34% year-on-year increase in median house price, from like $250 to the $350 in 1 year. So those are the kind of market forces you're battling against, and that isn't necessarily because we've created a sustainable panacea over there. We haven't made it into a sustainable wonderland, and everybody wants to pay more for it. That's just because the market forces are here, the people are arriving, and the prices are going up. So it's important, I think, to try to separate the two, or I feel it is in particular, that market forces and the way the real estate market is moving, and the need to still improve communities for people who live here today and for the people that will be moving here as new residents. The programs, the idea that you have a walkable neighborhood, a healthy neighborhood, is sort of independent, right, of whether someone is new, moving to the area, or has been here for a while, whether they paid $50,000 for their house or whether they paid $1 million for their house. So we try to focus on improving the quality of the community citywide. We try to focus on the ability to take efforts around improving affordable housing, $100 million a year, $200 million a year, ensuring that that's as green and healthy as possible, that those units are as high as they can be in energy efficiency, to keep housing costs low and things like that. But I guess the first point to make is that it is a very challenging problem. And it's challenging here in the district, and it's challenging for a good number of the cities you come from, where housing costs are skyrocketing.
Right.
To the second point, I think that the opportunity to look at projects like the 11th Street Bridge, create entire new assets for the community is very exciting, and it's one that you need to look at in terms of the big picture. You need to understand that the community will be changing, will be growing, and you need to build these assets in and make sure they're accessible to people at all levels of income.
Kids need parks, of course. Craig?
I would just add, I was on the mayor's Green Ribbon Task Force, which has played a role in helping guide greening. I would just say DC's done a fantastic job in terms of broad engagement. I think every ward feels like they've been listened to, they engage, public speaking, and not just listened to, but their input's been really important. And so the split in terms of equity of access to shaping sustainable DC has been, I think DC's been a model on it. So the second, picking up on Brendan's point, you know, if you affect the cost of transportation, which DC is kind of very deliberately doing, and the energy costs in low income, the benefits there are large. Low income is disproportionately adversely affected by health issues. Low income is very concentrated in areas with few trees. Very low albedo, meaning excess heat, meaning excess smog, meaning excess respiratory problems. And so the sort of systematic solutions the city's putting in place to bring down temperature, to make these buildings more affordable, to making the quality of life in the specific environments in low income, they are going to have measurable positive benefits, including economic. It doesn't offset the rise in value, but I think the city's really been admirable in how well it's addressed this and is addressing it.
Great. Jack?
Yeah, Jack Spangler, Harvard Roundtable member. Thank you both for rising early and coming and sharing this with us. Very, very informative. In fact, Brendan, I'm surprised you didn't mention MapDwell, the solar map for the city. And let me point out to our colleagues here, if you go to the website, MAPDWEL, you will get the solar potential for every square meter of rooftop in the city of DC. And this is now getting more available in other cities. It started in Cambridge, Mass, with my friends at MIT that did that. But I want to bring back to public health. And just to share this point, I heard just this past week from Peter Senge told us about Vancouver and all of BC, where they have a program for the hearts and minds of all the citizens and the children, and they map down to the census tract level indicators of happiness and thriving and social ability. These other key factors of cohesiveness and thriving of a community. That's an interesting program to look at. And the other one, that experiment going on in Washington State, called One Science, where they are looking at family services to reduce the toxic stress on children that are huge predictors of life outcomes and behavior, risky behavior, as well as medical health outcomes and economic outcomes. So these are really innovative programs that fold right back into what cities can do. And I wanted to bring that to people's attention.
Those are great, Jack. I think we want to put references to those on the web page for this workshop. Those are fabulous resources. John? Thanks.
Thank you. I just want to echo, John Balbus with the NIEHS, also Roundtable member. I just want to echo, this is incredibly exciting work. It's incredibly exciting to see all the detailed analysis that you have done in terms of the potential health impacts and the valuation of those health impacts. The question I have is the figures that you gave us, and you said 10% increase in reflectivity will have a 6% decrease in heat deaths and so on, are risk assessments, and they're based on assumptions and based on risk assessment methods. The question I have, I didn't hear a lot about the evaluation of this and trying to look at the actual health impacts. What sort of program do you have in conjunction with the Department of Health? In particular, in a city, a lot of these health impacts are mediated by very, very small scale phenomena, and it's very hard to do kind of air pollution mapping, heat mapping, or anything at a very highly aggregated level and know that you're actually talking about reality in that top floor building under the hot roof. So what sort of evaluation process do you have? And in particular, I'm going to tie it to the last question, which is if you have a neighborhood and you increase the value of the homes 200% and you change the people in the neighborhood, you will change the health in that neighborhood. And so how do you take into account, how do you evaluate the program in light of the population changes that may be occurring as well? Are you tracking the original residents?
I can only speak to that in generality. I think Dr. Davies Cole, our state epidemiologist, and others at Department of Health could answer those better. And it might be interesting as you're sort of writing up this part of the program to dig in with them a little bit more to get the detail that I can't provide. And then initial answer is that many of these programs are only just starting to happen, right? So even ideally we would be doing the baseline assessments and have that information now, because then as we move to cooler roofs in residential neighborhoods, as we plant a tree and then wait a decade for it to actually be big enough to do anything, as we make changes that are long-term, some of these need to be looked at long-term, and I don't know actually that we're planning, I suspect we're not planning as well as we should be to look systematically at the benefits. I hope, and I think Greg and others will help us do that. There may be other cities that are leading in that area.
And you have a school of public health that would help you do that.
Yeah, I was going to say, I do know that perhaps some faculty at the Dean's program are looking at neighborhoods in the city, relationships of, for instance, heat to air quality and things like that. There are other we're benefiting actually, from the academic world. There's a team at the University of Michigan. DC is one of their pilot cities, and they're coming on the ground to look at heat impacts and establishing risks, but also setting some baseline data. So I don't know that I can provide too much more information other than to say that it's something we should be doing, and I think it would be interesting to follow up. It would be helpful for me to follow up and have a better answer, and to get one for you as well.
So John, one of the John Davies Cole, who's the state epidemiologist for DC, has been helping us as well. We've gone through and actually gotten health data by ward, and including hospital visits, because you have somebody who suffers from asthma or allergies, they go to the hospital, they can't pay for it, somebody pays for it, right? I mean, it ends up being a real cost. And so mapping those costs has taken quite a long time, and I think we've at least taken a step in that direction, because those are quantifiable, and they do vary by income, they vary by location, and so you can begin to map things which are triggered by or contributed to by excess temperature due to urban heat island, and saying we can reduce those morbidity, mortality incidents and the associated hospital costs by addressing its part of the core issue, which is excess heat in low income. So we're trying to do that, and it's going to be a small step down a long path, but it's I think we're starting to use that data in a way that's constructive in terms of shaping policy and quantifying in a fairly rigorous way what this means.
Bernie.
Bernie Goldstein, University of Pittsburgh, a roundtable member. I want to challenge you in two ways. But first, let me say this is really exciting, very encouraging, great to see how you're measuring things. I agree with John that measuring the health, you're just the right people to be able to do that. But two things I didn't hear about. One, in a sense, follows up on Lynn's opening remarks where you talked about young people wanting to be in the cities. We're certainly finding that in Pittsburgh, but at the same token, we also find that when they have kids and they start thinking about education and the inner city schools simply aren't good enough, they move out. I suspect the same thing's here in Washington. I know anecdotally it certainly is, that your school system is not very good. You're working on it but separately from the whole sustainability issue. How are you going to keep people in these areas that you're building up unless you improve the schools? Why isn't that part of your system? Why isn't that part of your discussion? At least in the presentations you made, and I hope I'm wrong. I hope, in fact, you're doing lots of things on it. The second is, if you're looking at bringing public health into urban revitalization, perhaps a population with the greatest public health problems are the homeless. again, I haven't heard about what this does to the homeless, what you're trying to do to bring better housing to the homeless, getting them indoors. I wouldn't be surprised, I know nothing about it, if this abandoned bridge, in fact, is a place where there's a lot of homeless living right now. How does that fit into your plans?
Well, I'll mention, I mean, those are two areas where there are others in the city that are leading, and in particular on education, I think the district is seen as one of the cities in the country that has, done significant work on school reform in the last few years. So we have, for instance, my kids are at public school in the district, and our school is growing so rapidly that they added another 6 portable classrooms this season, because we're at like 50% over capacity. And that's not true in every school, but public school, traditional public school. But the city is seeing a turnaround that is now leading, so the public school enrollments are increasing year by year, and they're increasing faster each year, which goes a little bit to the point that young people move here and families are staying here. It's not true all across the city. There's certainly inequities in that. We also we have, I think, one of the most robust public charter schools. We have about 40% of public school students in the district are now in a private or public charter school, which are all over the city with a whole variety of focus areas. So the city has moved pretty rapidly, I think, on school reform, much for that reason, right? I mean, a core element of this sustainability you're talking about has to be educational opportunity, K to 12 for sure. There's been a huge emphasis from the current mayor on early childhood, so there's now universal pre-K for the city, available for all 4-year-olds, and I think moving down to 3-year-olds, or all 3-year-olds. And then also looking at higher education through the city's community college and university. So there's been a huge emphasis. I can only do it a little bit of justice to talk about it, but I think there are starting to see the statistics which show the families are staying, the numbers of enrollment are rising, and it's very much related. The problem is that, again, the families that are staying and the schools that are bursting at the seams tend to be in pretty affluent areas. Diversity is decreasing in some of these schools as they are made more and more of people living in that neighborhood as opposed to kids moving around the city to schools. There's a bunch of issues. It's very complicated and there's a long way to go, but the city's been tackling it, very significantly. Homelessness is another issue. Both of those came right out. If you look at the election campaign that we just ended, education was probably the #1 issue. Affordability might be second. Homelessness was a significant one. Not that the numbers are as high, but it's a very high visibility issue right now as the city is trying to figure out how to move people into permanent housing, how to move people into transitional housing, and frankly getting away from some debacles of recent years where the city has just been overrun by the numbers. As the affluence increases, the housing prices are going. We've had recent years, especially last year's cold winter, when it all converged, right? You had more and more people not being able to afford housing and colder winter, which led to the city having to mobilize in a way it never had around hypothermia and homelessness. And in the news right now, there's discussion about how the current mayor and the incoming mayor are planning to deal with, because we're going to have a transition to mayors right in the middle of the winter, January 2nd, and they're trying to figure out how to move forward on securing housing opportunities, particularly through the winter. But there are a whole range of homeless programs as well that have been a major focus of investment and trying to figure out the best solutions.
Linda.
Linda Birnbaum, Iowa member and director of the National Institute of Environmental Health Sciences. So I have a couple comments and then a question or two. And first of all, I really love the fact that you've tried to economize and give numbers, quantify some of the potential benefits of what we're looking at, because I think that's the only thing that sells in the current political environment. But a comment that I do have is that health is not just a personal issue and not just something that people can make changes themselves. So I applaud the effort to change kind of the structure of the city. But some of the questions I have, well, first of all, the roundtable will be sponsoring a workshop in March, which is going to deal with the environment and obesity, and the focus of that workshop is actually that we now know that there are environmental exposures, and I'm not talking about walkability or exercise or diet, that leads or is associated with increased risk of obesity. And so we need to think about some of the other environmental stressors that are involved, and I do mean stress as one of them, as well as chemicals, different kinds of chemicals that are present, air pollution, things in our food, things in our water, and so on. So I was just kind of wondering, I love all the attempts to make use of abandoned areas or former areas and turn them into farming areas and victory gardens and so on. But I'm kind of wondering, has anyone done any checking to make sure that the levels of lead and cadmium and other heavy metals, for example, are not highly elevated so that we don't continue to poison our people with the residues of what we had before? And the other question is related to LEED buildings and green buildings and so on. Has there been a life cycle analysis done of some of the materials that are used, including solar panels, which have an expected lifetime of 20 to 25 years and involve some really, really nasty stuff in them?
So let me do a first shot. The only garden-related question I can speak to is the one that we were involved in funding. That's producing more than £1 million a year in Anacostia. That's actually hydroponic, and it's extremely tightly measured, and so the quality of produce is very high. It's very fresh. There are no contaminants. It's not exactly organic, but it's much more carefully screened than conventional greens or lettuces that you would buy. With respect to life cycle, I mean, I think the LEED has done a great job in driving that upstream, downstream. We invested a lot in large-scale photovoltaics. There are some nasty metals in some of the PV options, like cadmium telluride. Those are much more carefully monitored. The whole move has been toward upstream and downstream life cycle assessment. So PVC, for example, is great to use, and it's great as long as you don't have to manufacture it. It's great as long as you never have a fire, great as long as you never have to dispose of it. But if you kind of think about the front end of PVC and the back end, there's some real health questions, which means that the preference against using it, which is built in LEED, which has met, by the way, a lot of industry resistance, makes a lot of sense on a life cycle basis. And I think DC's leadership in adopting not just certified LEED, but LEED Gold, LEED Platinum, means that the health, both in terms of operations and the upstream, downstream, where do the materials come from, where do they get disposed, and what are the consequences in terms of the food chain, water and air, those issues, I think, are being addressed better and more comprehensively. And I think the quality and the change in quality of how that's addressed in terms of rigor and completeness has improved a great deal and continues to improve quite quickly. So I'm pretty encouraged by that.
Yeah, in terms of the physical on the ground, so we're lucky in a way, even though we're not a state with voting rights yet, so we didn't get to vote for any senators or representatives last week. We are a state for EPA regulatory purposes, so we have a very robust program for the city. We have 300 people in our agency that includes toxics and clean air and clean water programs. And so we regulate use of soils and cleanup very rigorously here, and have very high standards. So anybody who is looking to develop, like the site in particular they're talking about, is now being cleaned up in order to make way for that program, even though that program will only be using stuff that's on the surface, right? That's not cultivating the soil. We also have a new laboratory that the University of District of Columbia has opened, which is certified for soil testing and providing free soil testing for people that may be doing agriculture at their home, and then also community gardens and things like that. So it's something we're trying to address, although I would say that the default for a number of programs we've got are greenhouse-based, are above the soil-based. Not as much of it is that's in larger scale production is cultivating. We don't have that much space, to be honest, so there's a lot of aquaponics programs developing, fish and plants together, and as well as hydroponics. So we're trying to look at, although to be honest, there's also some gaps there, right? Regulatorily, who regulates the quality of food and the cultivation of soil is not one of the clearer cut questions in the regulatory world between EPA or FDA and others. But I think we have some pretty strong programs in place to try to address that. And in terms of the life cycle of the buildings and the materials, from the city perspective, to be honest, we rely heavily on LEED, on the industry associated with it, on the certifications that are provided by LEED and other of their partners in industry in terms of the materials that are used. We don't always get it right, but I think increasingly the learning curve there has been rapid, and to try to reduce those indoor environmental health factors and risks.
Thank you. Next question.
Fayez Bojani, roundtable member from Shell. Very informative and exciting, and I'm going to talk a little bit about the employer perspective, so a few perspectives, a little sharing, and then a couple of questions. So, the talks that you gave resonate very well and complement some of the efforts that we at Shell are doing. Probably very much like many other employers. Yeah. So the question will be related to that coming down. As we want to revitalize our work environment, which is a small but critical microcosm, right? So we have 4 distinct initiatives, and if I talked in detail, it would be like a carbon copy. Maybe no, not carbon copy, carbon-less copy. No pun there. So it would be very similar to the 2 talks that you did. One is around what we call Connect. Yeah, Connect is around designing workspace to enhance engagement, connectivity, thoughts and ideas, energy, synergy and efficiency, and sparking of innovation and creativity, very similar to what you were talking about. The other one is and all of these are under the health umbrella. So the other one is Be Well at Shell, which is creating, some subtle nudges for subconscious, enabling of people to make healthier choices like be well, think well, sleep well, eat well, breathe well, move more, etc. Right? And the third one is around energy and water use and reclamation and carbon capture and sequestration. Yeah? And the last one, which we are in the very early phases, is extending these into beyond our fence line and beyond our workspaces, which is families, home, communities, etc. So my questions around that is, currently what we are doing is based on what we call as value on investment rather than return on investment, because we don't have or did not have the numbers that you put together. So I'd be really interested in figuring out if we can use or how we can best use some of the quantification, because at the end of the day, the better we quantify, the more we can do as part of the extension of improving the environment. The second question is around building partnerships. Employers cannot do this all by themselves, nor can the NGOs, governments, etc. We have to develop partnerships and figuring out how we can help each other, because the ultimate goal is still the same thing: thriving people, better environment, right? And last but not the least, I was wondering, at the end of the day, health, well-being, thriving is a very personal, voluntary activity, particularly in US. So what thoughts are given around the personal accountability of how individuals contribute to this? Thank you.
Okay. Anybody want to who wants to tackle that?
There. In general, I just, in terms of the private sector role, say from a carbon perspective, it can't be understated, right? I talked about a bunch of government programs and what we're trying to do, but we are still a small actor when it comes to carbon. Our ability to directly control the city's emissions is about 6%, 94% in private control, right? And you could use similar numbers probably for making people healthier or getting them exercise, right? It's all about motivating private action, whether it's in businesses, and the home and the family, or at school, or such. So the ability to achieve any of our big picture goals comes down to working with private sector, motivating private sector business and institutions, individuals to move. We'll use regulatory hammers, if you want to call them hammers, regulatory tools when we can to set standards. So, for instance, this summer we banned use of polystyrene for takeout food containers, and we're moving to a few other opportunities that theoretically would reduce a risk that we see from from polystyrene in food containers. The idea is then that is replaced by alternative products that are compostable and more easily recyclable, right? And so we reduce a risk here, create an opportunity there, and so we will use some of the tools where we can force an action and make a change, but getting to promote and sort of on a voluntary basis action by the private sector to do the things you're talking about, connectivity of people in the workplace. We have a number of our programs that are voluntary based, and one that's just about to launch again is called the Smarter DC Challenge, very much focused at challenging businesses to be smarter about the way they operate. This is all voluntary stuff, right? We provide incentives where we can, but it's about networking, it's about leadership from the private sector, and then in the workplace, but ideally then along the lines you're describing, taking it to the individuals and back to their homes and residences. And in terms of finding numbers, the one reaction that you mentioned, we met recently with the new leadership from the DC Chamber of Commerce, and their question is, all right, let's work harder, let's focus more on the business case here. Businesses will act out of goodwill, right? They'll act out of leadership. There'll be a competitive challenge will move them. But when you've got the business case that says you need to use that green power because of this economic reason, or it costs you less, or it has these other benefits, that's when you see the real movement in the market at a larger scale. So we also need to be working to make those connections and have it be something that pencils out as a business case. And we don't do it enough yet. And we're working hard. We're hoping through some partnerships with local universities to start ramping up that kind of research effort, at least for the DC market.
If I can add to that just a little perspective, we just built a LEED Platinum building, and each step of the way there was somebody involved in the administration somewhere else in the university who thought we were spending too much on something. Even the LED lights. Why are you installing LED lights? The additional expense of each light bulb. And we were fortunate enough to have a sustainability office in the university who could come up with the cost savings for the electricity, help us do the comparison so we could justify the lights, right? But that just happened over and over and over again. And when I'm thinking about it, many businesses simply don't have someone like that. And so where would you go? Who could quickly provide you with that information to come back with that counter argument so that you can, install the lighting that you think you should have or other features?
Right. And going then all the way from the lighting and energy side to the health side, right? Like you do this for this reason, and you make your interior or you run your office this way because the people will be healthier and they'll be at work more, and the bills will be lower and the medical premiums will be lower. Or, something like that. Who's going to defend and make those connections for you? And right now, Greg's working on it, right? And there's a bunch of people working on it in different places, but it's not all, the case isn't always there. The research isn't as robust as it needs to be, and having the advocate on site to help push and move people that way, that's what we're hoping to do with the city program, that in partnership with the private sector to help move that information, the education around it, the data out to the private sector.
DC's been...
Another point on that is that some of the schools in my university never see their electrical bill. If I were the dean of one of those schools, maybe I would have said, they're right, I should buy the cheaper light bulb, I pay the electrical bill. And so it made sense financially for me. And I think that's still a problem with larger institutions and businesses.
DC's put in place this infrastructure that is really supportive of individual getting their benefits recognized, and this is true with photovoltaics. DC set an ambitious target for renewables. Functionally in the city with limited land, you're talking photovoltaics. So the value of what are called solar renewable energy credits, SRECs, means that for an individual homeowner, you're getting bombarded by people who want to put PV on your roof, and we put PV on our roof. We're we're net neutral on electricity on our home, which our kids love. They totally get, which I'm jazzed about. And but that's there because the structure that DC created. Similarly on water, those incentives devolve very quickly down to individual design decisions at the business and home level. And then, as I said earlier, I think the process DC went through for sustainability really engaged every community actively, and literally, dozens and dozens of meetings where people were listened to, they felt engaged, they were a part of a process, they were recognized. So it's really been a broad educational process. So the educational process combined with distributed incentives, I think, has meant a very high level of involvement for DC citizens who are benefiting from and learning about how they make their life greener and healthier.
Richard Jackson, I'm at UCLA, member of the Roundtable. If you ask the average American today, does DC work? 90% of the people in this country would say no, it doesn't work. And to listen to Brendan and realize that a city that 15, 20 years ago I thought was just hopeless and did not work, that you have really transformed. And I think it's going to be very important that you document this success. And this business of documentation, I want to stay on for another minute, because after we build buildings, we do commissioning, we look to see whether, what's going to happen. But we have not really documented benefits adequately. And there's supposed to be a 1% set aside for art in many places. There's supposed to be a 1% set aside for evaluation in public health programs. And I think there needs to be the funding, I would assert there needs to be the funding to really document these impacts that you're doing, because this can't be done by a busy epidemiologist or public health researcher that's already got 50 other things to do and doing it out of goodwill. It has to be supported. So, quick question. One, Brendan, what flipped the switch? Why did this place go from completely dysfunctional to really a paradigm and a model, number one? And Greg, number two, I was fascinated by the economic graphs. They're very dense, and I was having trouble quite understanding how your credit score, well, I understood the implications, though, that suddenly the suburbs are going to be the slums of America, and what's going to happen to because it's hard enough to be poor where you have public transportation, but to be out somewhere where you don't have a car and you've got to get to food, to doctor, and to meet your life needs is going to be so very difficult. So I hope you'll, and I know you will, make sure the references are available, because some of those slides are going to take quite a bit of study to really grasp. So, but thank you very much for terrific presentations.
Sure. I mentioned one thing just on that question of suburbanization, or the next evolution is just a mind-boggling question, right? So we are in the city where it's now a wealthy, dynamic city, growing income coming in, people coming in, and have I think an opportunity to lead. We need to be leading because we have the resources to lead, and we are transit oriented in development, and we have a lot of the benefits. But if you start looking at how to move these concepts to suburban America and to 90% of the rest of the world, it is extremely difficult. And you also run into the fact that we are still very much building the old way. We're building, if you just go 15 miles from here, you'll find the same exact type of housing that was being built 10 years ago and 20 years ago. Maybe it's a little denser, maybe there's a few more townhouses instead of single family, but there's a big disconnect. And so there's groups like Urban Land Institute and others that are looking at how to change that and how to go back and retrofit. How to take a system that was built around the car and it was built around suburbanization and to make it into something different. And this region is doing that in very interesting ways in Tyson's Corner or in Bethesda Rockville in the district. So I just would mention that it's a problem I don't have to deal with because I don't have a suburb. I have to deal with it as a region, but directly I'm all urban.
People point to Manhattan as just a fantastic model of walkability, but there are parts of the 5 boroughs that are completely unwalkable. So it's not so much whether it's in a city or not, it's whether you know, and a lot of the walkable areas are emerging both in cities and in suburbs, and it typically involves an intentional constructional effort where you've got sort of, you've got a combination of public and private incentives and investment, which means that there's a place that people want to go to. There'll be a couple of restaurants, there'll be a park, there'll be a bookstore, and all of a sudden you've got a place that people want to walk to, and you get additions to that. You've got flexibility in zoning, so you can have retail below and residential above, or conversely, that your retail is allowed to put residential above. And the fastest growth in the last 5 years, and this is best documented by one of my partners, Chris Leinberg. He's done a couple cover stories in Atlantic on this issue, is in suburban areas which intentionally develop these walkable spaces, and those often serve low income extremely well.
Just quickly to the what flipped the switch, I mean, there's a bunch of different switches. I think mayoral leadership in our city flipped the switch. I mean, if you look at the administration of Adrian Fenty, our prior mayor, education was his issue, and he just went, you know, right at it and fought for control, and it was a big brouhaha, and it led to a variety of, you know, really significant changes. Our current mayor has worked on a broad range of issues, but he did make sustainability one of his areas, and invested in it and provided the bully pulpit that helped so much of the rest of us in the government, staff folks, move things forward. And so leadership is huge, but also I would say one of the, I think, the examples we look at in the curves of the city are the green building curves, right? And so you see this 2003 or 2, you know, there's like a couple of big green buildings down here. And this is for the city, which is the home base of the U.S. Green Building Council, right? They're over here on L Street. So we have been the home base of the thinking around this for a while. But you look at the development of the DC Green Building Act in 2005 and 6, which is very much a coming together of the private sector and government and builders and such around a piece of legislation that said, yes, this is the future, we're going to move this way. And actually, that set out a law in 06. It set standards that wouldn't really take effect for a few years for the private sector, and yet that process of coming together, people realizing this is where the market goes, this is how you can save money and life cycle costs of buildings, you just see this huge you know, upswing in adoption of green building practices in the city. And I think a lot of it has to do with that coming together around a piece of a policy in that case.
So we have several more minutes for this session. I want to go ahead and go through the 4 people who are standing up at the mic, and then we're going to actually take a brief break at that point to switch over PowerPoints and stuff.
I'll be quick. I'm Al McArtlin, roundtable member and from EPA. You know, kudos, Greg, for successfully applying BenMap. It's, I think it is my first example of a sort of where transparency and public availability of our data, et cetera, pays dividends. So I'm thrilled to take that example back for bigger reasons or broader reasons. Brendan, I'm going to twist your words slightly with it. You didn't have to. I live in Northern Virginia, so and I take the metro into work almost every day. Of course, we get a subsidy for that. But every time I drive, because I need the car, I'm leaving earlier or something, and I sort of kick myself, like, why did I do this? DC has a huge traffic problem, particularly rush hour problem.
Worst in the nation.
Right, and the National Air Toxics Assessment Data Program that EPA puts out, so we model really more than measure the air toxic concentrations by county. It was kind of surprising to me how high DC's air toxics concentrations were for benzene and other things. So when we talk about sort of public health and urban revitalization, I think there is an issue with transportation and toxic air emissions. They also get an ozone co-benefit, I think, because it's a precursor to ozone. But, I mean, DC and others, is there any work going on with, like, parking cash out, or, you know, my wife still gets a free parking space. She commutes with me. We choose, she declines it, but she still gets a free parking space. Yeah. But, you know, it costs her money to decline it. But are there other kind of nudges or policies in place that cities are grappling with to try to get people out of their cars and maybe flex a place at home, et cetera?
Yeah, that's another area where I'll point to the work of others. I mean, Shane, who's here with Washington Area Bicyclists, is leading, and they're at council right now pushing, there's legislation moving back and forth. We've had some successes. The most recent Sustainability Act that did a styrofoam ban also extended the requirement to provide transit benefits to a much larger swath of private sector employers. We haven't necessarily taken on issues like no free parking. Some of it, I don't know if she works for the feds or private, but there's a lot of that. Even within the federal government, they're still trying to reduce the amount of free parking they provide to their employees. There's a number of programs moving, mostly coming out of the Department of Transportation. And I think that another area, if you look just in the last 2 weeks, 3 weeks, they released the Move DC, sort of long-term master transportation plan, which I think is very, it's really an excellent piece of work. And there's a 2-year action plan, which has some of the front end work that they're doing there. So there is now a sustainability office within transportation, and they've been involved in this Move DC plan and the roles that mass transit and access will have going forward. So I'd encourage you to take a look at that and the work around it. There's a whole bunch of initiatives also that I didn't mention: performance parking and expanded bus routes, and obviously all the cycling work. You know, the negative version of it, and this is what the AAA folks will say at a hearing, is that this is the war on cars, right? They call it a war on cars. But for the reasons Greg mentioned and others, I mean, cars cost us a lot, right? $8,000 a household, the toxics you're referring to, the air quality impacts, the time. I mean, just the time. I said worst in the nation. That's the one where we, in the last year, I think passed LA in like the most time people spend in traffic. So there are a lot of reasons and ways you can improve people's lives by getting them out of their cars, and the city is working on a number of those.
I cycled here, and the number of cyclists have doubled, I think, in the last 5 years, and it's great because you're like in this train of other cyclists, and you're feeling no car can touch you. So there's this kind of macho element when you reach a certain size, I think, in the percentage that's cycling, and it becomes self-sustaining. Al, I just want to say that Al and without Al and his staff, we couldn't have done what we've done. You've been unbelievably selfless and generous in your time, and it's another example of why EPA is you see I'm sort of trying to make nice so they'll continue to guide us and help us. But Al, thank you.
Paul.
Thanks very much for great presentations. I'm Paul Sandifer from NOAA and a member of the Roundtable. Brendan, I want to go to something you moved through very quickly. We know a lot now about the health benefits, very broad health benefits of green environments, and you talked about prescriptions written by physicians basically for outdoor activity in places that had been pre-screened. And I'm curious if that screening process involves carefully looking at the green aspects and whether the prescriptions also particularly target children with asthma. That's one of these things where there's definite health information relating to exposure to diverse environments, biologically diverse environments. And Greg, for both of you, the question then becomes, once you get this started, how do you educate and motivate private physicians to really take this seriously and to do something to help move people outdoors?
Again, I can only speak to the program generally, but I think we could follow up and get some more of the details. Wendy could help us do that in terms of how exactly the Department of Health, and again, that is an effort that's in partnership with the Primary Care Association. So they're working together there with the association to identify you know, how best to prescribe and hopefully doing evaluation of what's effective and what's not effective. So I'd have to follow up to get you more details on that.
That would be very helpful if we can get that and put it on the website, I think.
But to your point about access to green spaces that are actually biological diverse, so nature, for instance, you know, in the middle of a city, we're lucky in our city to have this, you know, well, it's a blessing and a curse, right, to be a federal district. One of the benefits is we get national parks, and we have a bunch of them, and they're fabulous. They can always use more resources and such. We also have a number of city parks that are wild spaces that are, you know, that are allow people to go out into nature, I would say, even though you're in the middle of the city. The mayor talks a lot about taking the paddle ride down from the Maryland line on the Anacostia River coming down through the city. You just would not know you're in Washington, D.C. So there's some really fabulous opportunities, and connecting people to those is one of our efforts. We've actually had sort of a particular task force on park access that has been looking at that. And trying to figure out ways where you use transit and other things to promote that kind of access. But it's tricky, and particularly when you add the development pressure on the city, when the land values get so high, preserving as much of that biologically diverse area is challenging. So it's an ongoing issue.
Minor thing, I mean, the enormous leadership DC's had in adopting green buildings has been specifically relevant to what you're doing, because there's a big emphasis on operable windows, and so you can open your window and you're sort of feeling the temperature, and you're bringing daylight further into the building and relying on daylight, and then the artificial lighting substitutes in for that to get your foot candles that you need for working on space. And so that sensitivity to how the outdoor benefits and impinges on a classroom, I think, is material impact on quality of life. And then finally, there's just been a lot of work that's documented relative recovery times in hospitals if you've got access to the outdoor and visibility. I think the best example of green roofs in DC is on M and 22nd. You got these very, very expensive apartment complex that Lagarde, who's head of the IMF, is in. There is a gas station under that refused to move because it's prime property, and the way they solved it is they put a green roof over it. So instead of looking at a parking lot with all the fumes, you're looking at a green roof. So it actually enhanced the value, and the value creation for the building owner who's selling these apartments, now looking out on green space, which is hiding, your gas station, is very, very large.
Thanks.
Thank you. Next.
Hi. Yes, Ann Carroll with the EPA's Office of Brownfields and Land Revitalization. That was almost like T in the abandoned gas station with the green. So one, I applaud DC for the great successful revitalizations you already have. I would be remiss if I didn't say there's an RFP open right now for assessment and cleanup, and as you continue to do urban agriculture, aquaculture, revitalization, those are eligible activities for the city. But I had two questions. One, given the amount of construction and property value changes that you're seeing, would you think about a TIF that actually focuses on health? And so as those property values increase, that's another way to harness and see more of that revenue stream back into the health departments, because they have, been dismembered over the last decade. And so kind of building up our health departments is going to become really important for the next generation, obviously. And then the last thing I would have you think about, and I can't pretend I have the answers, is with that level of construction and renovation and remodeling, the workforce has changed for who's doing construction in this country. And so now we have potentially an occupational health issue that we don't always think of as public health. And so think about who are the workforce that are doing those construction projects, those remodeling and renovation, and maybe that can be another funded piece of that health TIF. So, and I look forward to working with you all again.
Thank you, Ann. And those are broad comments, but did you have comments?
Well, the TIF, the tax increment financing tool, is one that the city here has used a lot, not for that purpose specifically, but for general economic revitalization of a neighborhood. The neighbors or the landowners agree that as improvements are made, some of the increased tax value will be dedicated back, back to the city, or they'll be the value will be captured. There are examples around the country of green TIFs. I'm not familiar with on-the-ground examples already of health TIFs. I would think that some of those green TIFs may well have a number of health-focused outcomes very well integrated in them. It would be interesting to see where those are. There's been comments and discussion here about that. Overlaying green TIFs or health TIFs. We have we've started to get fairly active with the eco districts focus effort. There's a nonprofit called Eco Districts, but also a whole range of efforts focused on district scale solutions. The idea that you can't solve all your problems just at the building level. Some things need to be because buildings are connected more effectively, or neighborhoods are designed more effectively. So in some instances, those eco districts have moved forward with a TIF kind of effort to provide upfront funding and then recapture the increased value over time. Short answer is we don't have any moving here yet.
I'm probably the only one who needs you to spell out TIF.
Yeah, so it's TIFF, tax increment financing something. What's the second F? I think there's a fund, maybe, financing. Isn't there
Tax increment financing. So it's a tax-related financing tool to accomplish these things.
Yeah,
Okay.
so you essentially provide you provide upfront value. Money is made available through the government and then paid back over time on assessments of the taxes of the people who own around there and would benefit from that. I think that's, I don't understand all the ins and outs, but I think that's the general idea.
With respect to green for affordable, it's actually really interesting, and I think it's a great story. I had the opportunity to work on designing what's now the national standard for green affordable housing. It's called Green Communities. The principle on that was enterprise community partners. And there are a couple things about it. One is that if you were living in those houses when the sort of the tax period that drives the economics, hey Chris, I just quoted you earlier, by the way. When it elapses after 15 years, the occupants can then own that property, and if that property is green, it has a much higher value than non-green, both because the neighborhood's more attractive, it's better maintained, it's more flexible, it's better designed, and for many low-income families, it's the single largest opportunity they have to get equity, a significant equity. And the second, I would say, is on the outside board for Cherokee Investment Partners, which does a couple $2 billion in construction and has the master planning role in Charlotte and stuff. And what they found, which I think is really interesting, is that this sort of requirement that's imposed for developers of valuable property to include low income, there's a stigma associated with that. And what's interesting is when it's green affordable housing rather than conventional affordable housing, that stigma is much less. So they're much less likely to be sort of shoved off to the corner and barricaded and instead be integrated in. In other words, the aesthetic and the kind of quality associated with green design offsets the sort of stigma of affordable and makes affordable a more attractive or less undesirable build-out requirement for conventional developers. And so that's sort of an unexpected outcome of a green design option for affordable.
Okay, our last question, Insei.
Hi, thank you all again so much. I'm Insei Obit-Witherspoon, the executive director of a national nonprofit that's actually been based here in DC for the last almost 15 years. I've also been around in DC and went to graduate school here, so I've been here 20-some years. So it's extremely exciting, being that I've worked with a variety of partners in the area and the region on childhood asthma, childhood lead poisoning, housing, healthy housing issues, to see where a lot of the systems approaches that you're mentioning, which is very exciting to hear you using those type of public health related ambitions, which a lot of us want to see more of. So it's exciting to see DC becoming a leader on that front. You mentioned Kids in Nature initiative, as was referred to a few minutes ago, and aging, and definitely the connection to education was mentioned. But I really do think that as we continuously as a community continue to leverage these issues and try to gain additional partnerships, especially ones of various levels of influence and power and whatnot, it's going to be through the lens of a child. I think that's really going to continue to be one huge motivating factor, regardless of social, economic, and all the other variances. So you did mention, for example, access to affordable early learning, childcare, but I would offer that access to childcare that's potentially making children very sick would not be my alternative. So I think, again, those type of efforts need to be happening simultaneously, and certainly I know of many of those that we could help connect you to. But could you speak a little bit more to any of the other specific child health-focused initiatives that you're bridging the gap on or trying to bring and include into these efforts?
Well, it's a very good question. I don't know how well I can speak to them, or if I've had that question in that lens before. You're right that many of our efforts are focused around that. And so the principal initiatives of this mayor and prior have been early education access, have been educational quality, have been Play DC, the playground programs. We have a number of pieces of legislation, Healthy Schools, which is focused on school nutrition and access. There are a lot of them. I don't know that I could summarize them and without leaving out some of the big ones. But has there been, is there a focused effort specifically trying to bring together and look at those opportunities to leverage and to really maximize the benefits you're getting from the different programs? I don't know if there is from that perspective. And that's the case in so many things we do, right? Is that the education people, the pre-K education people are doing one thing, the K through 12 people are doing another thing, the food people are doing another thing, there's safe routes to schools and from the transportation department, and so the list goes on, and I think they do a pretty good job of coordinating, but I think your point is very well taken, and an interesting opportunity, if you're local, we could talk about it more,
yes, we can talk about it.
About how you emphasize that. Because you're right, that's what, that is a rallying cry over and over again, whether it's access to nature or access to healthy food, it's going to be focused on benefits to youth.
Thank you.
All right, thank you very much. So we're going to just take a brief break, maybe 10 minutes, to switch over the slides, and then we have a very exciting session coming up about Detroit. So come back here, and we'll see you in just about 10 minutes.